biggest worry for pharmacists is staffing levels. She joins me now. Thanks for your time. What are you finding? Are you suffering from people going sick or self-isolating yourself?
Good afternoon. Well, pharmacy teams are working incredibly hard across the country, but yes, it is a worry because we've got to make sure that they're staying well, really, and therefore I'm really encouraging the public to ensure that they recognise that their interactions with pharmacy teams might change. For example, we're limiting the number of people who come into pharmacy, so you might find that only 3 people can come in at once, for example. And it's really crucial that we do this because we need pharmacy teams, pharmacists to stay well so that we can keep supporting vulnerable patients.
And how do you enforce that if people are, frightened and worried about getting their supplies and, pharmacies running out of stores, that people will try to push in? It's very difficult, isn't it, to monitor that and to force people to stand 2 metres apart?
It is very difficult, but I would urge people to follow this guidance because we want to make sure that we can continue to be able to provide medication. At the moment as well, many pharmacies across the country are providing delivery service to vulnerable patients, and many of those patients may be self-isolating. So we need to make sure that they stay well. So really this is a plea on behalf of pharmacists across the country, pharmacy teams. Please respect our boundaries and our social distancing and make sure that if you have coronavirus symptoms, you do not enter the pharmacy.
Is there anything can that be done, if necessary, to help on the deliveries front? For example, would you welcome community groups, offering to take deliveries from the pharmacy to older neighbours, for example?
Well, if you've got neighbours who can look after and support, then that's absolutely fantastic, provided, of course, that they don't have the symptoms. And also a number of volunteers across pharmacy sectors are helping at the weekends. For example, hospital pharmacists are helping support their community colleagues at the weekends with deliveries. It really has been a whole sector approach, supporting each other. We're helping ensure that fewer patients end up in hospitals. We are here past the NHS working as hard as we can. And, I really commend everyone who's doing their ultimate best for these patients.
Okay, many thanks indeed, Thorrun, Govind. We will obviously heed that advice, and of course pharmacies are utterly crucial in terms of keeping that public service going on. Many thanks there.